Choosing the correct LAL sensitivity, lambda, is essential to ensure that your product's endotoxin limit is detectable even after the product has been diluted to overcome interference. Here is a breakdown of how to choose the right value. 1. The relationship between lambda and MVD. The most important reason to choose a specific lambda is to satisfy the maximum valid dilution MVD requirement. Inverse relationship. As lambda gets smaller, higher sensitivity, the MVD gets larger. Why this matters? If your product is difficult, causes inhibition or enhancement, a larger MVD gives you more room to dilute the sample until the interference disappears. 2. Decision criteria. When to choose high sensitivity, lambda equals 0.03 or 0.015 EU per milliliter. Interfering products. If your product is highly colored, has an extreme pH, or contains detergents/proteins that interfere with the gel clot formation. Low endotoxin limits. If the drug is administered in large volumes or intrathecally into the spine, the endotoxin limit will be very low. A highly sensitive lysate is required to detect these tiny amounts. When to choose standard sensitivity, lambda equals 0.06 or 0.125 EU per milliliter. Standard injectables. Most routine antibiotics or small molecule drugs work well with these sensitivities. Balance. These are often the sweet spot because they are sensitive enough for most MVDs, but less prone to accidental contamination from the lab environment than the 0.015 sensitivity. When to choose low sensitivity, lambda equals 0.25 EU per milliliter. Simple matrices used for water for injection WFI, simple saline or glucose solutions where there is zero interference. Cost and stability. These are often more stable and cost effective if high dilution isn't necessary. 3. Summary selection table. Product profile. Ideal lambda. Selection. Strategy. Complex/interfering 0.015 or 0.03 EU per milliliter. Increase sensitivity to allow for higher dilution. Routine/validated 0.06 or 0.125 EU per milliliter. Standard industry approach for most meds. Pure water WFI 0.25 EU per milliliter. Use lower sensitivity. Dilution is not needed. 4. Practical step. The inhibition enhancement IE test. Before finalizing your choice of lambda for a new product, you must perform an IE test validation. 1. Pick a lambda, e.g. 0.125. 2. Calculate the MVD. 3. Test the product at various dilutions up to the MVD. 4. If the test fails, the positive product control doesn't clot, you must either change the pre-treatment of the sample or switch to a more sensitive lysate, lower lambda, to allow for further dilution.